spirometry.
We have to do the practical regarding the spirometer. So this is the spirometer we have, the portable spirometer. So what is the reason for using this machine? Why do we use it? What is the purpose?
To measure.
Anyone? Yeah. So yeah, to get a basic idea about the lung volumes as well as the capacity. So what are the lung volumes you know? Yeah. Yeah. Yeah.
Residual volume.
So with those volumes we can get certain capacities. What are those capacities?
Forced vital capacity, vital capacity.
Yeah. So functional residual capacity, vital capacity. Yeah. Yeah. We can measure all those volumes. So apart from that, there is also another use from this machine. What is that? So there are lung diseases, right? So what are the two main types of lung diseases?
Obstructive and restrictive.
Yeah. So why do we need this to? How do they relate to each other? So what does the type of lung disease have to do with spirometer? So why do we need this for those two diseases?
Because we can calculate the FEV₁ such EC ratio and from that
Yeah. Yeah, so this machine can also calculate the forced expiratory volume in the first second and the forced vital capacity as well. So with that we can get the FEV₁ over FEC ratio, and with that we can diagnose whether this disease is a restrictive or a obstructive disease. So what are the what is the normal value in the ratio?
70 to 80.
Yeah, 80% or 0.8. So how does the value differ in both the lung diseases, both the types? Yeah. Yeah. So it's increased in restrictive lung diseases and reduced in obstructive. So why is it that the value decreases in the obstructive lung diseases?
Expand.
So the ratio is reduced.
Yeah, so in obstructive lung diseases, the patient has trouble exhaling. So because of that, in the first second, the patient is not exhaling a lot of air. So the FEV₁ value is reduced. However, the FVC can be normal or increased, right? So because of that, the FEV₁ to FVC ratio decreases. Clear? Right. So in restrictive lung disease, what happens?
Lung expand.
Yeah. 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 So if EV₁ is more or less normal, it can be reduced, but compared with the FVC, it can be the reduction is low, right? So in restrictive lung diseases, the lungs are unable to expand as normal lungs. So the FVC is reduced. So the ratio should be higher than the normal reference ratio. Clear? Right. So those are the basic principles. So I'll show you how we use this. I need a volunteer. So first we have to get the consent from the patient as with any procedure we do. So once we do that, so we have to explain that patient is supposed to use this to get an idea about their lung volumes. And if we are using this to diagnose obstructive or restrictive lung disease, we have to mention that as well. So let's say we are now checking for the force that ratio, FEV₁ to FVC ratio, right? So first get the patient seated, so sitting down, and then we turn on the machine. Yeah. So then we have to provide the patient with a new mouthpiece. So these are new ones, unused ones. So this is a used one. If there was a used one, you remove it and replace it with a new one. So yeah, we apply it like so. Right. So after applying, we go to the setup, and we have to first enter the patient information. So in this menu, you can either select a patient already entered into the machine. So I'll select the patient 1. So you can insert the weight, height, the sex, the age, and whether he's a smoker or not, like that. So after selecting the patient, we go on to this menu. So there are several tests. So the FVC test is what we are going to do first. So there's 2 options, pre and post. So pre means before we give the bronchodilator to the patient, right? So that's the first test. Post is after we give the bronchodilator, right? So we'll do the FVC pre-test. So we go into the settings. So after going into the test, we have to give the patient the instruction. So we have to first ask the patient to sit comfortably, and then ask the patient to take 3 to 4 normal breaths. Then we have to ask the patient to take in a deep breath and exhale as fast as possible, right? Then again inhale. So that's the instruction we give the patient, right? So after giving that, and also the patient should have a nose clip ideally, because the patient could leak out air from the nose while doing the test. So I don't have one with me right now. So ideally the patient should have a nose clip, right? So once we give the patient, we've given the patient the instruction, we give this to the patient, and we hit enter, and you can start. First normal 3 to 4 breaths, then take in a breath and exhale as fast as possible, then inhale again. So once we're done with the test, we can either enter it to the system. So in this instance, I'll print the results. This is how a normal the printout would look like. You can get the values, FVC, FEV₁, and the ratio, and there are several other values as well. So with that, we can determine whether the patient is having an obstructive or a restrictive lung disease. Clear? Right. So apart from that, there are other tests as well. So I'll move on to the other one, the SVC1. So this stands for slow vital capacity. So if we go there, so like before, you have to take a deep breath and breathe out, but you don't have to be as forceful as before, right? So it's not forced, it's just slow, right? So keep your mouth on the mouthpiece, and yeah, we'll start. Yeah. Now taking normal 3 or 4 breaths. Just slowly take a deep breath as much as possible and take it all out, not as fast. Now, again normal breaths. Normal breaths. So you have to breathe in and out for at least 1 minute. Right. Now the test is complete. We can print out the results as before. So in this you get your values. So SVC is the slow vital capacity. So you can get the expiratory reserve volume, inspiratory reserve volumes. So this TI stands for the time during inspiration, right? And the TE stands for the time during expiration. So the VT stands for the tidal volume, and you can get all these through this, right? This test. So that's basically it in the using of the spirometer.
That brings us to the end of this video. Thank you for watching.